As a physician, I see a number of different complaints of different types presenting in men and women, presenting in adolescence and in childhood. The treatments that I plan are on an individual basis. I plan those via the best evidence, the best treatment, both nationally and internationally, and I try to design the treatment according to both my views on it and the patient's view, and we tend to work as a team. What I like to try to do is to guide the patient into a diagnosis that is as accurate as possible, and during the consultation I use quite a number of prompts that I send the patients out with, so I'll write down what the diagnosis is, what the management plan is, and what the future holds. Whilst trying to be reassuring, I also have a practical approach, and where medicines are necessary, I like to try and guide people into the right sort of treatments. I work with a multidisciplinary team that involves physiotherapists, occupational therapists, and I also try to work with people's families and partners, so I encourage them when they come to their consultations to bring in somebody who they trust, who can be an extra pair of ears and listen to my explanation and my experience. Whilst people can be very bright and switched on, when they're put in a consultation environment, they remember very little about what they're being told because they're concentrating on getting all the messages across to me. The sort of armament I have involves drugs, predominantly because I'm a physician rather than a surgeon and I don't do operations. I also provide injections, both intramuscular injections to damp down inflammation and injections into joints, ligaments, and alongside tendons and areas of inflammation. I will provide guidance on exercises, and I'll also use the expertise of my physiotherapy colleagues to plan a campaign of repair and rehabilitation for patients who need to build up muscles and flex and exercise joints. That particularly relates to people with spinal conditions. I have a number of imaging techniques that I can use, and within the Runnymede Hospital, where I provide my private practice, we have an MRI scanner, we have a CT scanner, a bone densitometer for measuring people's bone density, and plain normal X-ray facilities. We also have a team of musculoskeletal radiologists who can provide guided injections to difficult sites using ultrasound and X-ray guidance.